Okay, this is Dr. Sean again. This is week 4 for medical terminology, and this is another kind of speed run. I'm going to go through and just introduce you to some of the terms, some of the things, and some of the stuff in there. Let's go through the stuff that's right up here. Where is it? Up here. So you see week 4. If we look at week 4, let me move this stuff over for me. There we go. Move it over for me so I can see. And you should have there's my cursor. And week 4, breathing, respiratory system. Respiratory system has words like trachea, larynx, carina. That's the split where the bronchioles come off the trachea. The trachea is this one in here. Larynx, pharynx, nasopharynx, that stuff. Septum, you have a septum in the middle, a deviated septum would be bent over, right? These are the nares, right? And you have nasal hairs, and you have sinuses and turbinates, and as we go down, we've got all kinds of sinuses. And then we have the uvula. That's that punching bag thing in the back, right? Right there. And then you also have, below that is the epiglottis. Epiglottis is what closes when you swallow food so you don't breathe it in, right? As you go down, there are cilia, and they're little tiny little finger-like cells that have finger-like projections that push stuff up so we can get back to the esophagus and go down and get burned up and eaten up and done with. So like muck when you and cough stuff up, that's where it's going. Interesting thing about those, if you see your sputum has little flecks of blood in it, it could be because you're coughing too much. Maybe you have whooping cough, which is called croup, or which is a weird coughing sound. It's very, very uncomfortable. I had it a couple years ago as a, like weird thing. The other part too, let's see, you could have pneumonia. Pneumonia can show up in different phases and different colors of sputum. Sputum is the spit, right, that you have. The green usually means some bacteria. You can have brown, you can have yellowish, you can have just clear, right? Depends on what's going on. It's not really diagnostic per se, but it is a good indicator that something not is good going on there, right? Eating, we're talking digestive system, and then we're going to talk about the lips and the teeth and the different kinds of teeth, right? So you have the incisors here for carrots and things like that. And then you have these first bicuspids, and then the canines, and then, you have the other incisors, the canines, which is the eye teeth, they were called, and then the first bicuspids, and then the tricuspids, and then you have the molars for grinding things. As we swallow down, it's called deglutition. Chewing is called mastication, right? So it's going to say, I was masticating today in class. And everybody goes, ha, 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 because they don't understand what the word means, right? But now you do because you're taking terminology. Anyway, as we come down here, let's see what the learning objectives are for the whole week. As we go down through here, it's going to load very slowly. Week 4 learning objectives, employ the terminology for pulmonary, that's lungs, right, in relation to structures and functions of the respiratory system. As we go down, also we have both lungs. There's 2 lobes on the left and 3 lobes on the right. 2 lobes on the left because that's where my heart is, right? So it takes up some space. And then 3 lobes on the left on the right because we have a little extra space. Underneath it is the diaphragm, which is an umbrella-shaped muscle that is weird because it's one of those muscles that is both voluntary. It means I can stop it for a certain amount of time, or increase its action, but it works automatically through the phrenic nerve. Phrenic nerve comes out of C345, which is C345 keeps you alive and keeps that all working together. Okay, that's neurology back in the day that we did. Other things in there, you have the bronchioles, the bronchiectasis would mean it's constricting down. That would be like asthma, right? And other diseases like that. We have different ones like, pertussis. And febrile pertussis would be like a fever and cough. Sneezing and those kind of things as upper respiratory. Coughing is usually lower respiratory. So apply terminology to gastroenterology. Gastro always means stomach. Entero means inside. So the stomach and innards study is what that means. The structure and functions of the digestive system. Wait. Let's go down here. How am I missing out on my list? Okay. Applied termination to gastroenterology. There's that word there that I was talking about in the digestive system. Terminology for urology. That's the kidneys. Now, that one I think should be connected to, or it is connected, but it should be discussed with cardiovascular because they're so intimate together. These all should be actually with cardiovascular because the lungs, because your heart moves blood to the lungs to pick up oxygen, drop off CO2, and then it goes through the whole system where it has to get filtered out. So your kidneys filter blood, right? It takes the plasma, which is the liquid form of blood, takes out acids and takes out uric acid and takes out some other hydrogen atoms and ions and things like that, and different minerals and whatnot, and helps you maintain that homeostasis. Remember that one from week 1, right? There you go. Homeostasis comes back again and again. Communicate clearly, accurate in medical terminology for urology, pulmonology, and gastroenterology in written and verbal forms. Okay, fine. Let's do this right now. We're already at 5 minutes. My God, that's so fast. Respiratory system. Gastroenterology really is kind of interesting because we have what's called the alimentary canal, which goes from the lips all the way to the anus, which is the bottom. These are sphincters, by the way. That one is a nice voluntary sphincter. For some people, it isn't. But as it goes down, then you hit a second sphincter, cardiac sphincter, right at the top, or right at the top of the right below the top of the diaphragm, and that leads into the stomach. And then you have the stomach, and then you have a secondary sphincter there, which is the duodenal sphincter. And then you go all the way down through the small intestine, which has 3 parts, and that'll bring you to the cecum. So you have the ileocecal valve, which is down on the right side, right next to where the appendix is. And the appendix can burst or have problems with people. They have to have it removed. We just found out that now, didn't just found out. A lot of people have known it. It's just it wasn't well accepted that it actually holds a little bit of your biome. And biome is an important word these days. It means the natural bacteria that's inside you that helps you live and helps you process things, like make vitamin B12. So as you go through, they got the small intestine, like I said, 3 parts: the duodenum, the jejunum, and ileum. Ileum because it's always open for some reason. And then we have the cecum, which is the lowest part on the right lower quadrant, right down the right lower side. Comes all the way up the ascending, what's it called? Ascending colon to the hepatic, which is liver, flexure, goes across transverse going this way, right? And then it goes over here to this side, my right side, my left side, and that's the splenic, because the spleen is under there. Remember, the spleen has to do with recycling of blood and some immune functions. And then it makes a turn and goes down to the descending colon, and then that hits the sigmoid colon, which looks like an S shape, and then it goes to the rectum, and then the anus. The anus has 2 sphincters. One is voluntary for the most part, and the other one is involuntary. So you get that, like, involuntary one goes off, and you're like, ooh, I gotta go, and then you go, and then you're able to go. Whatever, right? Oh, okay, so here we go. We just got some different diagrams. I went through all of the stuff in this diagram. You should be able to spout those off pretty quickly. You guys learned this too. You've had some other things like, what's it called? Anatomy, right? Kidneys. Why does it say diseased kidneys? I don't know why, but they do put it, like, if they put a transplanted kidney, they put it in the front so they can do ultrasounds and take blood samples from it easier. I have one patient that went through that. He was on a lot of medications, but he feels much better, and they leave the other 2 kidneys in there, which is really wild. Here's the digestive system, all in a one big old swath of things. Look through those. You should be able to get that pretty easy. It's not bad. We have pancreas, and that's a gland. Looks like fat, actually. And then here we have some of our inflammation of the bladder. Let's see if I can do these really quick, and then we're done. Okay, let's do this one right here. Muscular contractions that push food through the digestive tract. Peristalsis, perfect. Surgical removal of the gallbladder is a cholecystectomy. Chole means gallbladder. Chole means cholesterol, actually. Cyst is the bladder part. Ectomy, to cut out, right? What's this one? Glomerulus. Let's see. Medical test that examines the large intestine using a thin, flexible tube, where they take pictures, actually. That's a colonoscopy. Don't have to. I mean, you can just look. Colon-oscopy, to scope the colon, right? Inflammation of the bladder would be cystitis. Cyst is bladder. So cyst is a container that holds water, or a bladder is a thing that holds water, or holds fluid, actually, I should say. Difficult or painful urination, dysuria, right? Painful urine. Why is that not sticking in the place? Okay, there we go. A tube that connects a urinary bladder to the external part of the body. I would say the urethra. When I first took anatomy back in the 1900s, I remember I thought it was Aretha, like Aretha Franklin, and I got it wrong, and everybody laughed at me because I had to do it in front of everybody. But I never forgot it after that. A cluster of tiny blood vessels in the nephron. Nephron is part of the kidney where filtration begins. That's the glomerulus. Great word for someone who's Japanese. They cannot pronounce that at all because R's and L's don't exist in Japanese words. And so it's a really messed up one. Pretty funny if you have classmates that are Japanese. Inflammation of the stomach lining. Itis is always inflammation. Gastro, stomach, gastritis. First part of the small intestine is the duodenum or duodenum. That's right up in here. And then the basic function of the kidney is filtering and... Ooh, wait. Okay, so we have one wrong. So glomerulus, nephron, the functional unit. Functional unit is the nephron. The functional unit, basic functional unit. Remember, we have a lot of terms like that. So the basic structure of life is the cell. The powerhouse of the cell is the mitochondria. The whatever. This is the basic functional unit is the nephron. Okay, nephron and then glomerulus is a small piece of that. Let's see part 2 here. Inflammation of the nasal passages. Nasal is going to be usually sinuses or rhino. So there's rhinitis. Rhino like a rhinoceros, right? Has a big nose is what it means. Difficulty breathing is dysp. Okay, so let's see if we have dyspnea. There's dyspnea right there. The process of breathing in. Inspire. I hope you guys are inspired. Oh, well, this is just inhalation. Inhalation. Okay, this one here, the number of breaths taken per minute. Well, a rate, respiratory rate. Between 18 and 22 generally is accepted. You can do less, you can do more. When I was in the hospital after my heart thing, I decided, hey, I got a lot of time, I'm not doing anything, so I'm going to meditate. And I would meditate, and my respiratory rate, my heart rate, and my blood pressure would drop, and it would set off the alarms. They have to come up and reset it for me. It was kind of crazy. Inflammation of the sinuses, sinusitis. There we go. A flap of tissue that prevents food from entering the windpipe. I talked about that in another video, or no, this video actually. Epiglottis, thin layer of tissue that lines the outer surface of the lungs. That's going to be the pleura. So you have the visceral pleura on the lung itself, and then it flips around and makes a little sac called the parietal on the wall. Parietal or pared in Spanish means wall, so it's on the inside. You have a little fluid in there called pleural fluid or serous fluid, and if you get a pleural rub, it's very painful. If you get a poke in there, and I stab myself, and the lung can collapse. Okay, so last one we're going to do here is primary muscle used in the process of breathing. That's a diaphragm. And this here, infection of inflame the air sacs of the lung, pneumonia, and inflammation of the bronchi, bronchitis. There we go. So I just wanted to do that one. That's 12 minutes. I went through as much as we could in just a short amount of time. Hopefully that clams it shut for you guys. Good luck on the thing. Don't forget the discussion board for this one. Let me see. Super duper duper quick is going to be a colonoscopy. So they're going to stick a camera up your bum and look at your insides. A lot of people like to bring those in and show people, like, look at me, I have a clean colon. Anyway, look for this term. We already have 9, and I have only read 3 of them. So there you go. So good luck on those. Take your time doing them. If you have any problems with them, let me know. Make sure and get those discussions and watch my discussion. How to get more points on the discussion boards, because that's important, and that's what's hurting a lot of you. So, and it's easy to make up, man. You can just, again, quantity is not quality. Talk to you later. This is Dr. Sean over at FORTIS, and this is week 4. Talk to you later. Bye.